Okay, yeah. Dr. Raval, thanks for agreeing to give this grand rounds talk today. To introduce her, Dr. Amy Raval is a research associate professor of neurology at the Miller School of Medicine of University of Miami. Dr. Raval's research focuses mainly on understanding the mechanisms of sex differences in cerebral ischemic injury. So her major research focus right now is to identify and to understand the mechanisms by which oral contraceptive use in combination with smoking exacerbates ischemic brain damage in women. With that, I will ask Amy to start her talk. Go ahead, Amy. Whenever you like, you can start talking. Thank you.
Good morning, everybody. Thank you for being here at this early hour. And Dr. Vemganti, thank you for inviting me. I can't see all my friends here, but I'm sure they are there. And thank you again for inviting me. This is a great opportunity for me. Today, I'll be talking about how oral contraceptive can affect the brain and what impact it has on stroke outcome. So, as we all know, stroke disproportionately kills more women than men. Women have a higher lifetime risk of stroke than men. 1 out of 5 women experience stroke, and that's why this is very near and dear topic to my heart. Uh, as we all know, there are typical risk factors for stroke: hypertension, diabetes, hyperlipidemia, high red blood cells count, smoking, and aging. Apart from these typical risk factors, women have sex specific risk factors such as migraine with aura, pregnancy, endometriosis, preeclampsia, fertility impediments, polycystic ovary, menopause, hormonal replacement therapy, and oral contraceptive use. And my lab mainly focus on menopause, hormone replacement therapy, and oral contraceptive use and in context of the stroke. So, oral contraceptives are pharmacological drugs usually taken 21 over 7 days. During the 21 days of pill, that is active phase of oral contraceptive cycle, where uh, pill is provided with the estrogen and progesterone compounds, while the 7 days, that is the inactive phase of oral contraceptive cycle, where the tablet contains the placebo content. Basically, oral contraceptive work by inhibiting the uh, hypothalamus pituitary ovarian axis, and this inhibition of GnRH, LH, FSH, and is achieved by estrogenic compound mainly. That's why the main compound, that is estrogen, that's very important in case of oral contraceptive. Historically, oral contraceptives were approved in 1960s by United States Food and Drug Administration. Since its inception, within an year, there was a case report that reported fatal pulmonary embolism in 2 women. Subsequently, there are multiple reports that reported some kind of cardiac infarction or some vascular event leading to thrombus formation and stroke. Uh, that Therefore, the association between oral contraceptive use and vascular complications was established early on, and because of that, over the period of time, we have gone through multiple generations of oral contraceptives. Currently, we are at the 4th generation of oral contraceptive, and if you pay attention to the lower panel, you can see the original estrogen contained in the oral contraceptive in 1960s was 150 microgram per day in a brand name and void, as against today's contraceptive has less than 20 to 25 micrograms per day, as low as 16 micrograms in some brands like Lolo. So, if we pay attention to the normal physiological range of estrogen, which is between 40 to 400 picogram per ml, the oral contraceptive dose is pretty high. And the question remains to be asked is this low enough for the inhibition of hypothalamic pituitary axis, or we have still chance to go low? And I'll make my point why we need to go still low. So this was a meta-analysis that was published in 2000, and this was one of the first meta-analysis that evaluated 16 studies from 1960 to 1999. This study evaluated ischemic stroke risk in high dose estrogen containing oral contraceptive users, and it demonstrated that with consideration for blood pressure, smoking status, and age, high dose estrogen adds additional risk factor for ischemic stroke. Subsequently, there was a um, meta-analysis that was published in 2014, which evaluated studies from 1980s to 2002. And this study basically evaluated ischemic risk in a low dose estrogen containing oral contraceptives. The low dose estrogen containing oral contraceptive use had reduced the risk of ischemic stroke. However, in a very recently published study in 2020, it still raises the concern that the risk of stroke in low dose estrogenic oral contraceptive users are high if they were to combine the use of oral contraceptive with the smoking. It is very important to know that as per CDC, there are around 59% of women between the age of 15 and 44 use oral contraceptives, and one-fourth of these oral contraceptive users also smoke cigarette. And this is very fresh study which is saying that the oral contraceptive use increases the risk of stroke during the first year of use as compared to what meta-analysis were showing after years of oral contraceptive use. So based on this study, we wanted to test this epidemiological studies in our lab setting, and we simulated oral contraceptive use and smoking derived nicotine exposure of women in a model of rat. So we take normally cyclic female rats, expose them to nicotine. For exposure to nicotine, we install the osmotic pump containing nicotine, which delivers nicotine somewhere similar to that of moderate smoking. For the oral contraceptive, we mimic the cyclic phase of oral contraceptives, and we expose rats to 3 days of active ingredient and 1 day of placebo. The dose of the oral contraceptive was derived from the women's contraceptive daily dose based on 1,800 calories per day as compared to rat, which is around 300 grams. Rat needs around 96 calories. Following the exposure of 16 to 21 days, which mimics more or less 3 or 4 of the estrous cycle, followed by that, animals were exposed to cerebral ischemia. And this is the figure that is showing that the nicotine plus oral contraceptive exacerbate ischemic brain damage. This ischemia was induced as a focal ischemia, that is a transient middle cerebral artery occlusion. We use two different ages of the rat, adolescent and adult, and this graph is showing the infract volume. So if you pay attention to saline, nicotine, oral contraceptive, and nicotine plus oral contraceptive groups in the bottom, you can appreciate that saline has a pretty low infract as compared to nicotine and nicotine plus oral contraceptive. The biggest infract is seen in adolescent brain following nicotine and oral contraceptive exposure as compared to that of the adult animal. But the bottom line here is nicotine plus oral contraceptive combination is inducing higher infract. As per the STAIR criteria, which recommends to test hypothesis using variety of stroke models, we also tested our hypothesis using global cerebral ischemia model of bilateral carotid artery occlusion and hypotension. So this graph is showing neuronal survival in the hippocampal region. And once more, we have these four groups where I would like to bring your attention to saline, which is presented as a percentage neuronal survival in hippocampus, that is 100%, as compared to saline group. Nicotine plus oral contraceptive has a very low neuronal survival. So the question is now is what is the mechanism responsible for exacerbated ischemic brain damage in nicotine plus oral contraceptive exposed females? As I mentioned in the beginning, that oral contraceptive contains ethylene estradiol, which has different affinity for estrogen receptor alpha and beta. As it is well known, estrogen works via these two receptors. So here is a diagrammatic representation of a rat brain where you can see the red indicates presence of estrogen receptor alpha and beta. Especially you can see that these are the region, that is amygdala, hippocampus, prefrontal cortex, and this receptor gets affected by this exogenous estradiol, ethyl estradiol, and that's why when women start taking oral contraceptives, they complain about changes in mood, anxiety, and cognition. On the other hand, it is very interesting that nicotine is an inhibitor of an enzyme called aromatase. Aromatase is an enzyme that converts testosterone into estradiol. And this is also one of the very common complaints among women smokers. When they smoke for pretty much 2 3 years, they have this early problems with their menstrual cycle. They usually suffer dysmenorrhea, and later on they have very low availability of circulating estrogen. And the interesting thing is, for correcting this menstrual problem, they are usually prescribed oral contraceptive. So because of nicotine is an inhibitor of oral aromatase, we wanted to test in our rat model whether these effects are also seen in rat. So we performed once more. Rat were exposed to the nicotine and oral contraceptive group, and the graph on your left side is showing you estrogen levels during the normal estrous cycle following nicotine plus oral contraceptive treatment, and the gray bar, black and gray bar, is showing you pretty low level of circulating estrogen as compared to that of the normal estrocycle containing estradiol levels. This reduce in estradiol is also affecting the brain, and we were looking at the estrogen receptors availability in the hippocampus. In a previous study, we published that there are low level of estrogen following nicotine plus oral contraceptive. In this particular slide, I want to bring your attention to mitochondrial fraction, where there is low availability of estrogen receptor beta in nicotine and oral contraceptive brains, suggesting that there is low level of E2, which may be inhibiting estrogen mediated mechanism. We did not find any change in the nuclear fraction, or we did not find any change in the estrogen receptor beta levels, either in the mitochondria or nuclear fraction. So our focus is mainly on effects of estrogen receptor beta following nicotine plus oral contraceptive. So this is little complicated slide, but I'll go over it. And here I want to make only one point: is the estrogen receptor beta that is on the mitochondria is very important to perform the mitochondrial function. Absence of estrogen receptor beta has been shown to uh, impact particularly mitochondrial complex 4 enzyme activity. Here the graph on your left is trying to show you when we isolate the mitochondria and expose them to either ER alpha or ER beta agonist, that is PPT and DPN, We see that when the mitochondria are exposed to AR beta agonist, we see the stimulation of enzyme activity of complex 4. The same was not true when the mitochondria were exposed to AR alpha. Once more, it emphasizes the role of estrogen receptor beta. Subsequently, we performed the same experiment using the samples from saline, nicotine, oral contraceptive, and nicotine plus oral contraceptive exposed animals. And here we are presenting data which is showing that the complex 4 enzyme activity is getting affected in nicotine plus oral contraceptive samples as compared to other groups, once more suggesting that the lack of estrogen receptor on mitochondria following nicotine plus oral contraceptive exposure is affecting the complex 4 enzyme activity even in the nicotine plus oral contraceptive exposed animal. So we were interested in looking at whether there is any change in the glucose uptake because the mitochondrial functions are getting affected. This was a very pilot study which we conducted in collaboration with my late friend, Dr. Francisca Diaz. And in this autographic images, you can see there is a saline and nicotine exposed groups. And in saline, there is a normal glucose uptake, while in case of nicotine there is some kind of saturation in the glucose uptake, and this made us think about what metabolic changes might be happening in the brain following nicotine plus oral contraceptive. So subsequently we perform metabolic studies. Once more, rats, normal cyclic rats, were exposed to nicotine and oral contraceptive following exposure for 16 to 21 days. We collected brain tissue for metabolomic analysis, and on the other side, other cohort of rat was exposed to cerebral ischemia, and we monitor cerebral blood flow over the period of time. This is a very simple slide which I want to just make one point, that nicotine that we are treating is actually reaching the brain because we did find nicotine metabolites in the brain uh, in the metabolomic analysis. Subsequently, we found that nicotine and oral contraceptive alters glycolytic metabolites. So on the left hand side, you have a glycolytic pathway where you can see some metabolites are coded in green versus some are in red. Particularly, the initial metabolites of glycolytic pathway coded in green, these are decreased as against there is saturation in pyruvate and lactate is decreased. So this brings to very interesting point. The pyruvate accumulation may be happening because there is a low enzyme activity of lactate dehydrogenase. And in subsequent studies, we did monitor lactate dehydrogenase protein levels and enzyme activity. On the right hand side, you have the graphs which are depicting that nicotine plus oral contraceptive has low level of glucose, glucose 6 phosphate, and pyruvate. Once more, the accumulation of pyruvate may also indicate the change in the TCA cycle, and we are seeing here that there is accumulation of citrate, cis-aconitase, and succinate once more in nicotine treated or nicotine plus oral contraceptive treated animals. So the one of the aspect that we wanted to check why there is a change in a glycolytic pathway, and is there any change in the rate limiting enzyme like hexokinase activity. So here is this graph on the left hand side. Basically, hexokinase is a rate limiting enzyme that converts glucose into glucose 6 phosphate or phosphorylates the glucose. The enzyme activity of hexokinase once more showed us that there is low enzyme activity of hexokinase in nicotine plus oral contraceptive exposed animal, and there is low availability of protein levels of hexokinase in the same experimental group, which is depicted in the figure on your right. So basically, the reduction in hexokinase activity is due to downregulation of protein expression and not owing to the post-translational modification that requires by hexokinase or any allosteric regulation. Subsequently, we also monitor protein levels of another enzymes which are part of glycolytic pathway. Here is the figure B, C, D, E, F that is showing you protein levels of enolase, PKM, phospho-PKM, LDH, and phospho-LDH. And once more, we are observing the same trend that nicotine plus oral contraceptive reduces particularly LDH enzyme availability, and this may once more indicate the defects in TCA cycle. This is a very busy slide, but I just want to make 3 points. First point I want to make is nicotine plus oral contraceptive exposure alters fatty acid metabolism. The fatty acid metabolism that we are seeing here is accumulation of free fatty acids, phosphatidylcholine, and carnitine acylcarnitine accumulation. The second point I want to make is this free fatty acid and acylcarnitine pathway is important for palmitoylation of variety of proteins, including estrogen receptor beta for their expression at the membrane level. So here the palmitoylation may be getting affected, and because of that we might be having low availability of estrogen receptor beta at the membrane fraction, including the mitochondrial membrane fraction, which may be affecting the mitochondrial enzyme activity that I just described to you. The third point I want to make is this change in fatty acid metabolism and TCA cycle also reflect in the low levels of availability of neurotransmitters like GABA and histamine. As we all know that energy metabolism and GABA and histamine regulates the cerebral blood flow. So we wanted to ask the next question whether cerebral blood flow gets affected following nicotine plus oral contraceptive exposure. So once more, we turn to autoradiography evaluation. Here you can see there are two panels. First panel is a baseline and the second panel is post ischemia 24 hours after global ischemia. If you pay attention to saline group, you can see in the baseline there is a normal flow. Once more, there is a gradient on the top, which is depicting gray means low flow, red means high flow. So you can appreciate there is a normal flow as compared to that of ischemia, which is typical of global ischemia, that there is a low flow in the hippocampus. Um, in nicotine exposed animal, before even ischemic episode, there is relatively low flow, and post ischemia there is a severe hypoperfusion, which is obvious even in the nicotine plus oral contraceptive group. So this indicates that maybe there is a lack of energy metabolism associated with the low availability of this cerebral blood flow. This both may be contributing to the increased severity of ischemic stroke. We all know people who suffer stroke, they're likely to give up smoking. And what consequences this smoking cessation might have on nicotine toxicity on the brain needs to be evaluated. So here, very pilot study that we performed, we exposed animal to nicotine, and following nicotine exposure, we withdraw nicotine, remove the osmotic pump, and wait for 15 or 30 days. Followed by that, the animals underwent focal cerebral ischemia. And once more, this infract volume is showing that even after 15 or 30 days of withdrawal, infract volume is not significantly low as compared to nicotine, suggesting that nicotine toxicity may persist long. We also perform some early behavioral study where we are showing that there is change in the fear conditioning response Just to recap this experiment very briefly, animal exposed to nicotine were or saline were put in this operant chamber on the day one when they are getting shocked, and on the second day when you put the animal in this operant chamber without any shock, animal tends to freeze, and we monitor this freezing behavior as outcome of cognition because they remember that the previous day they had the shock here. So here you can see in the sham group you have a very good freezing response. However, in saline group, which exposed to MCO, had a low freezing response. But if you look at the nicotine and nicotine withdrawal groups, you see that even after 15 or 30 days of withdrawal, the freezing behavior depicted in the black bar is not showing any changes, suggesting once more even the behavior effects last longer in nicotine withdrawal animals. Nowadays, when people try to give up smoking, they pick up this fancy looking device, electronic cigarette, and especially in younger generation, electronic cigarette is epidemic. I don't know about Wisconsin, but in Miami, every corner has vaping shop, and this vaping shop has a variety of flavors and very enticing to younger population. They are more complicated than ice cream or gelato places. So once more, this electronic cigarette contains very few compounds as compared to conventional cigarette, and that's their selling point that this has very low compounds. However, this does contain nicotine, and we still don't know what effect this electronic cigarette, particularly burning of the propylene glycol or glycerol, or this aldehyde volatile organic compounds may have on our health is still a question. However, uh, this is becoming very popular and that's raising concern. So we started experimenting on using the electronic cigarette. We have this little device that exposes animal to electronic cigarette, and we developed this paradigm where we are exposing animal during their active phase for 16 times to this smoking episode. Every half an hour there is a 8-minute episode, and during this 8-minute episode there is a 2 seconds of joule 5% nicotine puff followed by 8 seconds of rest. And based on this paradigm we are showing that the quotidian level in the brain of this nicotine EC exposed rat is more or less that of human EC consumption. So in future we plan to do a lot of experiments and see whether electronic cigarette in combination with oral contraceptive has same effect that I just described. But this is very initial metabolomics data which already showing that there is a sex difference following electronic cigarette vaping, especially in uh, tyrosine and tryptophan metabolism. And as you all know, this tyrosine and tryptophan are important for catecholamine and serotonin synthesis and release. Especially, it is affecting more in female as compared to male, and this may have effect on stroke outcome as well. So I want to put you with this last summary slide where I want to make only one simple point that nicotine plus oral contraceptive, as I showed you in my presentation, affects the aromatase enzyme activity, affects the glucose metabolism, and affects the cerebral blood flow, leading to more severe ischemic outcome and may have cognitive impairment for a long time. Today, I have not shown you data related with the neuroinflammation, but we have published data which is showing that nicotine plus oral contraceptive affects the inflammasome activation, that is an innate immune response following stroke, and affects the endothelial function, compromising blood-brain barrier, increasing edema that also adds to the severity of stroke. And finally, we don't have concluding evidences so far, but we can extrapolate that electronic cigarette may have the same effect, and we need to be paying attention to this because it's getting very popular amongst the young population. With this, I would like to thank all the members of my lab. Particularly, I like to thank Shahil and Hari, who are working very hard on this electronic cigarette project, and hopefully we'll get very interesting data soon. I also like to thank all my collaborators, particularly Dr. Perez Pinzon, Dr. Bramlett, Dr. Dave, and Dr. Dalton Dietrich for their support and guidance throughout my research. And I would like to thank all my funding agency. Without their funds, I can't do any work in the lab. Especially, I like to thank Dr. Chantal Scheinberg, who gets very excited with all my stories of estrogen and electronic cigarette and always ready to help me. With this, I would also like to thank all of you once more taking out time in the early morning, and I'm open to any question you might have.
Thanks, Amy. That's a wonderful talk and a very important topic. I will open this for any of the questions
Thank
from the
you very
audience.
much. This is Dr. Dempsey here. You make a compelling argument that this mechanism could be um, very diffuse in the brain. Do you feel it's the same mechanism in the subendothelial medial cells, the neurons, the glia? Because you talk about basic energy metabolism, or do you think it might be different if you look at individual cells in the brain?
So this is a very excellent question. Actually, I'm working on this. At present, what I'm showing you is a global metabolomic signature. I am not showing what is happening, especially in neurons versus glia versus endothelial cells. And that's what we are planning to do next. We are exposing some neuronal culture to see the effects are more or less same, or they are more towards neuron versus astroglia or endothelial cells. The point I wanted to make through my presentation is we know for ages that oral contraceptive affects the vascular complications, but within few weeks of oral contraceptive exposure, it's actually affecting the brain directly. And that's the point I wanted to make, that this early complication may make female more susceptible to stroke if they suffer one. And that's what one of the stroke studies showing, that within first year of oral contraceptive usage, girls are suffering stroke. And that's what I wanted to make a point. But I agree with you, I need to figure out whether it's in neuronal effect or endothelial or glial effect. Thank you for the question.
Very happy with that answer because I think that'll be a very fruitful area of investigation for you. Very good.
Thank you.
Um, Amy, from your talk, I feel that nicotine use is a more damaging thing than the oral contraceptives. I know that the combination is damaging, but are you using the nicotine when you use nicotine in animals? Is that the comparable levels to what we see in humans?
Yes. So what with the nicotine we use 4.5 mg. That brings to cotinine level that is compared to human use, which is moderate smoking. And with electronic cigarette, what paradigm I showed is also showing the moderate use of electronic cigarette. And I agree with you to a certain extent that nicotine is more harmful than oral contraceptive, but the combination itself is a complicated thing. And we did find some changes in oral contraceptive only metabolites. Particularly, we have recently analyzed the data of fat metabolism, and we are seeing that there is a change in sphingolipids, and that will be my next project. So in few months, I will show you what data I have with the sphingolipid, but we definitely see higher level of sphingolipid, and one of the component that sphingolipids can induce inflammation. So we wanted to check that in the lab.
Okay, yeah. And you show that just nicotine exposed, even without contraceptives, there is
Mhm.
more brain damage in females. So that also happens in males. Means nicotine exposed males show more brain damage if you induce stroke in them.
Yes, I didn't bring sex difference here, but yes, we do have data, and recently one of my colleague also published that it's in a different model of stroke, but yes, male also has a higher infarct volume in stroke.
Thanks, Amy.
Dr. Raval, thank you for this. A quick question out of curiosity. What about progesterone?
Okay, so I'm a reproductive physiology from basic training, and my understanding is progesterone also gets converted to estradiol. That's one thing. And secondly, progesterone by itself requires priming with estrogen, and then only progesterone works. So there are progesterone only oral contraceptives, but in the system, you have a lot of aromatase, including skin and fat cells has aromatase. So even though you give progesterone, it does get converted to estradiol or estrogen derivatives. So that's the one way they achieve the inhibition of gonadotrophins that I was talking about.
Hi, Amy. It's a very interesting topic, and you're doing a great work. And my question is, are there any studies showing how alcohol affects contraception? Does it function similar to cigarette and nicotine?
I haven't made my rats yet drink, so I don't know.
Are there any other studies? Anybody?
There is this Dr. Sorabji's lab is doing some. There is this new faculty, Samina Beke. She works on alcohol, and she shows in the neonates that it does affect their brain. So I'm guessing that it may have this effect,
Similar.
but myself I haven't tested it. That is a general question I get asked, because usually when somebody smokes, they also drink, and what effect it might have. But that will make my story very complicated. So to remain simple, I already have two components. So
Yeah. I think probably more women drink more than smoking while they're on contraception. So
exactly, my conception was that also. But with the invention of e-cigarette, you might be surprised. I teach undergrad classes, and one time I was like, what is this device? They look like USB, but they are not USB. They are electronic cigarettes. Believe me, it's very funny. They come in a variety of shapes and size, and all the matching thing. Like in old days, we used to change the dial of our watches. Now they change all the electronic cigarettes. So, and they come in a very, very fancy flavors like candy and strawberry and whatnot. One day I was very curious that I work on nicotine, and I ended up going in a vaping shop. It's the whole wall full of the flavors. It's very difficult to even choose what flavor you might want.
You're doomed. Thank you very much. Well done. Thank you.
Thanks, Amy, for the very important and nice talk. We appreciate that you took time to give this talk, and I hope everything else is okay in Miami with with all the hurricanes and everything. And but good luck in your research. Yeah,
Thank you very much, everyone.
thanks.
thanks,
Bye-bye.
Amy.
Thank you, Ma.
Isha, what do you from us?